team lead at the COVID-19 Treatment Center at the Greater Accra Regional Hospital, Dr. Ahiable, is worried that the country may soon record a spike in COVID-19 cases during this Easter. According to Dr. Ahiable, the situation would have dire consequences on the already overstretched health workers. He is therefore cautioning the public, especially churches, to strictly adhere to the safety protocols that have been stipulated.
We are saying that because of what happened during the Christmas and the New Year festivity. The numbers were going down before that time. Then after the Christmas and New Year, in January, February, numbers went up. Because during that period, people celebrate a lot. There are a lot of weddings, church conventions, people gather a lot. And when the protocols are not adhered to, there's a likelihood for people to they lose their guard and get infect others. And in January 1, December 1, 2, there were a lot of Ghanaians outside or foreigners were coming in through the airports. But this time around, I think the airport authority, the port health, have put measures in place to screen those who are coming out and to test them. So if we observe the protocols here in Ghana like we are doing now, I think this time around the numbers will not go up. But we should be strict and make sure that people follow the protocols. They can go to activities, but social distancing should be observed. They should sanitize regularly. They should also wear their face or nose mask when necessary. Already we are overstretched. Already we are tired. Now we have been in this battle for the past 1 year, since March. Yes, since March last year, a year and over. So we are tired. Some people working in the treatment center having gone on leave. They come to work every day. The psychological stress alone. When you're coming to work, you are thinking in case you do something, you get infected. So we are all, when you come here, enter here, some fear is in you. It takes the grace of God. So we don't want more cases to come, because otherwise we shall all break down. We have families, we have children, we have mothers, old people. Most of us, our parents are old. If we get exposed, we go to visit them during the festive occasion, we are going to give them infection. So when the numbers go down, it's good for us. So I can get time and enjoy our life. I'm a Christian myself. I'm a born again. We are all Christians, those who are here. Even if we have pastors among us, if we care to know. There are pastors who pray for patients, they evangelize while they are seeing them. We all know the right thing. So even the Bible has said it. Obedience is better than what? Sacrifice. Why don't we follow instruction? If we don't go to churches, our pastors tell us to observe the protocols strictly. We are not saying that churches will not happen. Gatherings should happen. They could happen. But we should observe the protocols. We should distance ourselves from people. The social distance or physical distance, as you may call it, is very important. We should wear our masks properly. Then you can interact like I'm talking with you. When we do that, I don't think there's anything wrong of not going out gathering. But another thing we should also say that when we go out for this gathering, we should not keep too long. Because I've heard the IGP saying of late that they are going to make sure that churches are held during the Easter within 2 hours. Because when you stay in an enclosed place for a prolonged period of time, and somebody once must go down, or we are human beings, there's possibility of people getting the surge of infection. So it's better we observe the protocols, and wherever we are, we don't stay there for long. It's better to be in an open area where there's flow of air or the wind is blowing. So these are the things we are saying. You shouldn't say that they shouldn't go out. They can go out, but observe the protocols. IGP has said it, that there'll be policemen in mufti, in plain clothes. They'll be among the congregation. So if for a church, we are going against that, even the Christian Council, is the chairman of Christian Council, he has also mentioned it that if a pastor or a man of God is arrested, don't come to the person's aid. So they should follow the instructions. And we follow, it's good for all of us. Because very soon, if we follow instructions and go for the vaccine, after some time, the infection will reduce to the barest minimum. You shall see infection once in a while, but not like we are seeing now. People with complications. People are also dying from the virus.
Now, Dr. Ahiable said the arrival of the COVID vaccines should not make people complacent. He explained that although the country had started recording decline in cases, it is too early to attribute a reduction in cases to the rollout of the first dose of the vaccines.
In January and February, we have a surge of COVID-19 cases, I mean severe and critical. But in March, we saw a decline in numbers. Hitherto, our ICU beds were fully occupied. But in March, we were not getting full capacity. So then after the vaccine came in, so before the vaccine came in, our ICUs were not full like before in January and February. And since then, I think we are not getting full capacity. Even though over last weekend, we had a number of people coming on admission, about 4 or 5 people. They have been referred from other facilities. So there's a steady decline, that's what I would say. It's not sharp, there's a steady decline. So, but all the same, we shouldn't lose our guard. Continue to do all that we know to do as far as the protocols are concerned. So the vaccine effect, I will not say, it's early to say it's the effect of the vaccine because the numbers were already declining before the vaccines came. So let's wait and see. Maybe after the second dose, which is supposed to be 8 weeks after the first dose, to see if the numbers will decline further. Then we can make an assertion that as a result of the vaccine, the numbers have gone down.